So vitiligo, it is an autoimmune disorder where the skin color is totally gone. We can just say the area which is affected by vitiligo is totally depigmented or milky white. So in vitiligo, you get milky white patches. Vitiligo can affect your cutaneous and mucosal areas. So cutaneous area means your exposed skin. So you can have vitiligo anywhere. You can have it over your face, your body areas, your arms and legs. And you can also have it over your scalp, or you can have it over your mucosal areas. Mucosal areas means that you can have it in your genital areas internally, or you can also have it inside your body. Vitiligo is broadly we can classify vitiligo in two types. One is segmental vitiligo and one is non-segmental vitiligo. So segmental vitiligo means that there will be loss of skin color in one particular area. So let us say if there is a patient who's having segmental vitiligo on the face, so the patient will just be having loss of pigmentation in one area. That area could be any area. It could be here, but it will be just involving unilateral area. Then there is non-segmental vitiligo, where you can have multiple patches all over the body area or specific body area. So mostly we see patients of vitiligo vulgaris or generalized vitiligo, where we see patients having patches in different body areas. In general, vitiligo is an autoimmune disorder, so anybody can have it sporadically. Okay, it is not necessary that there is a preceding history of vitiligo in family, then only one can have vitiligo. But in general, the common causes are autoimmune disorders like pernicious anemia is one disorder where you can have vitiligo. Then there are other factors like nutritional deficiencies can also lead to vitiligo. Yes, genetic factor is there. If somebody is having vitiligo in family, then there are chances one can have vitiligo. Then vitiligo can also occur after some trauma. Like after some injury, people can develop white. So mostly the important causes are nutritional deficiencies. Then it could be autoimmune. It could be associated with autoimmune disorders like pernicious anemia or diabetes. And it can also be associated, it can be hereditary. So it can be genetic. Vitiligo can occur in any age. We have seen infants having vitiligo. People have come with their neonates, maybe 3 or 4 months old babies, 1 month old babies, or 1 year old babies having vitiligo. So there is no fixed age of having vitiligo. You can have it after birth or you can have it later in life. And it is not necessary that if somebody is having vitiligo, so it's going to progress all over the body area. If somebody is having progression, let us say there is a patient who's having vitiligo and the vitiligo is progressing, then we always get the blood test done, because it usually occurs if patient is having some stress, patient is having some nutritional deficiency. So in such cases where the patient is having progressing vitiligo, then there we can add some oral medicines to control the spread of it. Many people think that vitiligo is not treatable. No, vitiligo is treatable. We can treat vitiligo. Okay, but the first thing is what time you need to start the treatment. What happens is when we have this misconception that vitiligo is not treatable, it is because patients come to us when the vitiligo has progressed all over the body area. So if you start the treatment early, the moment you get your first patch or the second patch, if you start the treatment then only, it's very we can easily control it. I won't say it's completely curable, but we can treat it. Initially, we always start with our treatment with medicines. Like we add oral antioxidants, we add medicines which boosts your immunity. We get the nutritional panel done. If there are certain, we can say deficiencies, we correct those deficiencies. Then there are certain immunosuppressants which are required if the patient is having generalized vitiligo. So that we also add oral immunosuppressants, like we have to add steroids. Lots of medicines are available. Apart from that, we have to give topical creams as well. So where we prefer tacrolimus, then we prefer topical steroids. Then coming to certain other therapies that we can add along with this thing. So then there's a laser which is available, which is known as excimer laser, which can be done for vitiligo. Then we have phototherapy, which is very effective in vitiligo. So these are the therapies which are done when the patient is having, you can say, unstable vitiligo. There we can also use it. But let us say the patches have cleared up and that the patient is just having one or two patches of vitiligo which are stable. Stable vitiligo means that the patches are not increasing in size. They have been stable like this for 1 to 2 years. So in those cases, we can do vitiligo surgeries. We can do skin grafting. Okay. So in simpler terms, we start our treatment with prescription-based medicines. We give oral medicines. We give topical medicines. We achieve as much correction as we can. Then we move over to surgical therapies or to phototherapy. So in phototherapy, we have narrowband UV phototherapy, or we can move over to some laser like excimer laser. And if the lesions are just stable and like localized, then we can do vitiligo surgeries. Okay, so those are skin grafting surgeries. Prevention as such is not possible because it is an autoimmune disorder. Okay, but there are certain things that we can do. Let us say there's a patient who we know is having vitiligo. Like I said, sometimes injuries can lead to vitiligo patches. So if there's a patient who's having a history of vitiligo, we can always tell the patient to avoid, injury. We can tell the patient to avoid excessive sun exposure. It can also progression of vitiligo. If the patient is having vitiligo, we can ask them to keep the stress under check. Okay. And then we can get regular nutrition levels done to prevent the spread. But as such, we cannot tell a patient ki you have a patient of vitiligo in your family, so you can do these things to prevent vitiligo. Okay, so prevention as such is not possible. But if the patient is a patient of vitiligo, there are certain things that the patient has to follow so that further lesions can be avoided. Vitiligo patients in general, vitiligo is a disorder which affects your skin only. It's not life-threatening. It's not going to affect you anyway systemically. But yes, because vitiligo means that the pigmentation, the skin color is completely lost. So such patients are very prone to have sunburns. And patients who have vitiligo, they are more prone to have sunburns and they are more prone to have skin cancers. In our country, skin cancer per se is not that common. So probably the issue of having the malignant lesions post-vitiligo is not common in India, but abroad it is common. So if we talk in terms of our country only, yes, people having vitiligo, they can have sunburns. In our country, there are lots of myths surrounding vitiligo. Firstly, wherever the patient comes, you will ask the patient what are they having. There are lots of diet restrictions that they are following if they are having vitiligo. People avoid non-vegetarian clear food. People avoid having something white in color like milk or curd. People avoid having salt with curd. People also avoid having non-vegetarian. People avoid having pickles and all. So food has nothing to do with vitiligo. You can have whatever you want. So you don't have to do any dietary restrictions in vitiligo. To cure vitiligo, it is very necessary that your diet should be balanced. You should not take out any food group from your diet. This is the first myth. If somebody asks me what can you consume to prevent vitiligo, so you need to have a balanced diet. We don't need to avoid anything. You should have a good nutritious diet, which is rich in proteins, which is rich in antioxidants. So don't devoid yourself of any food. So the first myth, vitiligo is associated with some food. And if we avoid those foods, we can prevent vitiligo. It's totally right. Second myth, mostly people come with this thing that vitiligo is contagious. Vitiligo is not contagious. Vitiligo cannot spread from touch. It cannot spread from person to person. It is just a change in skin color and we have to accept it as it is. We should not think the patient is having vitiligo, that patient can spread vitiligo. Third thing, about vitiligo, if mother is having vitiligo, are there chances that the kids will also get vitiligo? The chances are there, but they are less because vitiligo as such can occur sporadically as well. So many a times when we are sitting in our clinic, we get lots of patients for the same consultation that we have a daughter who has vitiligo and they are having difficulty in matrimony and all those things. So we just want to convey it to them that vitiligo is treatable and vitiligo is not something that will spread through touch, or vitiligo is not something that will happen to the kids as well. Yes, there are chances, but the chances are less. So these are the most, you can say, 3 common myths which are prevalent in our country. Dietary restrictions should not be there. It is not contagious, and it is not necessary that if parents are having vitiligo, the kids will have it.